around the globe. I want to welcome you, everyone who's found time to join us for this part of our first town hall hosted by the Trinity Challenge. So I'm Dame Sally Davies, and our audience in the UK and many global health people know me from my 9.5 years as Chief Medical Officer in the UK. But now I'm the Master of Trinity College here in Cambridge, and you can see the Master's Medieval Studies. I'm also the UK's Special Envoy on Antimicrobial Resistance, and I have the honour of being the convener of the Trinity Challenge. So today we're going to, in a minute, move into the panel session, and we've got absolutely great speakers. And I'm asked to ask you to submit questions at any time using the chat function, because our speakers will see them. And then, of course, we go into a Q&A before we close in a couple of hours. But before we get there, let me give you a brief background on the Trinity Challenge for those of you who don't yet know us well. I'll keep it short because many of you are familiar with what the Trinity Challenge does. We launched the Trinity Challenge in September last year with the aim of bringing the world's best thinkers and doers together to better predict, prevent, and manage and recover from pandemics. In the midst of COVID-19, actually early on, we all realized we can and must catalyze new ideas, novel approaches, and innovative tools, and ensure that all people everywhere are free from the shadow of infectious diseases. In practice, we're trying to collide data science with public health, and people who've joined us clearly get that. Unfortunately, it's still not fully understood across the globe, this dire need to move forward. So now, our Trinity Challenge uniquely brings together academics, NGOs, and private sector organizations whose data and skills hold the keys to deep improvements to global health, which is why our 37 member organizations come from all these backgrounds: academia, social delivery, and business. Our products may well end up used by governments as well as in health systems and in public health, but we are coming from this very mixed environment, engineering this collision of data tools, public health, and science to accelerate public progress and work in 3 ways. The first is the public challenge. We've collected a prize fund, which we can use to incentivize and reward your best ideas or others from across the sectors and countries, with a total amount of up to £10 million. Our ask is that ideas are practical solutions, scalable, global goods that will help us better identify, respond to, or recover from health emergencies. Secondly, as the Trinity Challenge, we facilitate innovative private to private, private to public collaborations led by our members to surface the best use of data, analytics, and tools to address these tough questions raised by the pandemic. Trinity Challenge is nurturing a unique environment for the exchange of ideas, perspectives, and experiences, which generates multi-sector, multi-partner collaborations. And we're going to have measurable impact over the next 3 years. And actually, it's terrifically exciting how people stimulate each other and come together across different sectors. Thirdly, and finally, we're working to improve the data ecosystem and enabling stakeholders to share data for value, but protect privacy at the same time, changing the language to privacy preserving. We work with a coalition of partners to promote trusted, transparent, and inclusive data tools that will achieve radical long-term health and economic benefits for our societies at large. So that's the setup and the working model of our Trinity Challenge. And today is really an exciting day for us as we're opening the portal for submissions to our first public challenge. And we're thrilled to announce that for the process and to make this happen, we've partnered with MIT Solve to deliver the inaugural challenge round. We all know MIT Solve has a strong track record of hosting open innovation challenges for social impact on their award-winning platform. Thank you for partnering with us, MIT Solve. If you want to learn more about how our public challenge works and how to get involved, join our challenge Q&A session right after this panel discussion finishes. and we'll share the link here at the end. So with that introduction, I'm excited to hand over to the Trinity Challenge Chief Executive, Hala Audi, who's going to moderate the panel discussion. Hala has been involved in global health before through shepherding Jim O'Neill's independent antimicrobial resistance review commissioned by our Prime Minister. And I'm delighted she's come back to public health and global health in November last year to join this very special initiative. Hala, over to you. Thank you.
Thank you very much, Sally, and thank you everyone for joining us today. I'm going to jump right into the meat of the subject and start the conversation with our panel because we have 4 exciting speakers. I first want to start with the lived experience that I think we all have had, which is obviously COVID has been a watershed moment in many, many ways. But when I think about the way it has changed the way we work between business, between companies and between companies and government, I've really seen a step change in the level of collaboration, and whether they're private to private or private to public. So I'm going to turn to our first 2 speakers today, Karen DeSalvo and Angela Spatharou, to ask them what their experience has been. And the reason I'm turning to Karen is that she is now the Chief Health Officer at Google. But Karen, you're also a doctor and have served in government under the Obama administration and as Health Commissioner in Louisiana, helping the recovery against Hurricane Katrina. So your career has really spanned these 2 sectors. And Angela, we're lucky to have you. You are a partner at McKinsey advising on national healthcare systems and digital healthcare reforms. So we'd love to hear both of your perspectives on this question of what COVID has changed in your business life.
Do you want me to start, Hala?
Yes, please.
All right, I'd be happy to. I'm just want to begin by saying how delighted Google is to be a part of the Trinity Challenge. And just as you mentioned, my background is in medicine and public health and in public service. And now I have the chance to work on this from the private sector and couldn't be more supportive, especially because of my lived experience about how necessary it is to have public-private partnerships to do the important work that we have not only now, but ahead of us. I mean, the pandemic has brought us a 21st century challenge. I mean, it's not that we haven't had an infectious disease previously or outbreaks or epidemics or even pandemics, but not in a time when we had 21st century opportunities for that virus to travel so rapidly around the globe. And so that requires us to have 21st century tools to combat it. And data and technology certainly at the top of the list. It's what I knew in practice and what I've heard recurrently from public health practitioners as they came into this pandemic with great knowledge and skill, though they didn't have all the tools at their disposal. So when we were asked at Google to be helpful, there are a number of ways that we thought we could lean in, and we have, and perhaps we can talk about some of them. And I know Sam's going to talk about some of the experiences with academia and technology companies, but I thought I might focus on one that got a lot of attention, which is the exposure notification system. This is a digital tool that's meant to augment traditional contact tracing, a vital strategy for public health to end outbreaks, including pandemic. We were asked if we could provide some assistance to the public health infrastructure to see if we could help identify people who had been exposed, and Apple was getting similar requests. So the 2 companies have arrived at a strategy that's privacy protecting. So it doesn't use digital GPS to track people. So it's privacy protecting because it uses Bluetooth, which also turns out to be very sparing of batteries. And it's also an interoperable system. It's essentially an API that we developed that can be only used by public health organizations, particularly governmental organizations around the world, and now has been taken up by more than 50 across the globe. And that means that it's in the hands of public health to decide how to build the risk scoring, how to share information with people who find out that they have an exposure notification, and we provide this back-end technology. And having these two traditional competitors come together, Apple and Google, to work collaboratively has been an extraordinary moment for us. I think we've all seen that a crisis like a pandemic brings people to the table. I would share with you all that Microsoft has also been involved because they've needed to provide some of the cloud support in the US context for our public health laboratory infrastructure that's hosting the servers. So we have this bringing together of technology and the public health enterprise around the world. Academia has been very involved to help us understand what's the impact of this tool as part of the toolbox, the toolkit that public health has. And there was some recent data from the UK, for example, showing that it averted about 600,000 infections and saved as many as 8,200 lives. And what we're seeing in other nations that have had adoption and uptake is that it's helpful, meaning that it's as good as adding additional contact tracers. So we are really proud of the work, but especially proud that we did it in this very iterative partnership fashion with public health organizations across the world and with academia, knowing that we didn't have the answers. We might have some tools and technology that we could bring to the table, and then in partnering with others, we could make something that was really useful to help save lives around the world. So a great example, I think, and the kind of, by the way, relationships that we have built around this tool is our relationships that we want to continue after the pandemic, to see that it's not just a one-off, but that we're finding ways to work collaboratively between technology, academia, and public health.
Great, thank you, Karen. That's such a great example and so aligned with what we're trying to create and embed with the Trinity Challenge. Angela, from your perspective, consulting and advising so many, both public health organizations and companies, how has it felt?
Thank you, Hala, and thank you, Karen, for the very, very interesting example. We work with different types of organizations, from multilaterals to big NGOs to obviously governments and private sector in healthcare. And I've had the chance over the last few months to lead the McKinsey Center for Health Improvement in Europe. So basically our internal think tank for healthcare in the broader European Union and broader European zone. And one of the things we have seen is, as you say, it was indeed a watershed moment. So what we saw was that healthcare for the first time became much more of a central treasury issue than ever before, and linking the macroeconomic condition to the outcomes in healthcare put a different focus, let's say, on our sector, in my mind, in very positive ways. So there definitely has been a flurry of interest in how to strengthen health systems, how to increase investments in health systems. And within that, one of the big trends we have seen that is relevant to what Karen was just saying is the push towards end-to-end digitization of health systems, creating digital-first health systems, and also the push towards using and leveraging the power of advanced analytics and, by extension, artificial intelligence in different parts of the system. So this is something that we see now for the first time getting the right levels of investment. We see multi-billion investments in individual countries. So France, Germany, Spain, and others have already dedicated budgets to this. But also we see the European Union coming together, creating the healthcare union, that for the first time is talking about a 5 billion investment to strengthen health systems around pandemic preparedness, but with a very big focus on, for example, creating common data infrastructures, data sharing across jurisdictions, improving data reporting, including reporting on things like such as, I don't know, from intensive care capacity to hospital beds and medically trained staff. So an exchange of data and accumulation of data in ways that we have not seen before, which I think creates a great base for collaboration in Europe and creating the data sets and the use cases that will help us. And then, of course, on the private side, we have seen a huge amount of collaborations, and many people today on this town hall, I think, are intimately involved with several of the very interesting initiatives. But we have also seen, apart from these types of partnerships between pharmacos, big tech, data providers, telcos, life sciences, etc., we have also seen a lot of movement on the health tech side. Companies, first of all, increasing massively in market capitalization, getting a lot of investment and interest, and going into a market by market spree of business development, acquisitions, etc., that will position them hopefully in a good way for a digital first future of the health systems. So with all that in mind, I think there's this tremendous momentum across the board. And the question, I think, for us is how do we keep this momentum during, but also after the COVID period, so that we do indeed transition health systems to digital first and leveraging analytics in a different way.
Thank you very much, Angela. And these are all such striking examples, and I'm pretty sure we would all agree we want to sort of bottle this learning and make sure that we build it for the long term and build on it. I'm going to turn to Sam Scarpino now, who is assistant professor at Northeastern. And Sam, you lead a lot of the work, the epidemiological work coming out of Northeastern, and you're an epidemiologist, but you also use complex systems and computer science and network science to inform your work on epidemiology. What I want to ask you is, why did you put the time it took to join the Trinity Challenge when you did, when surely you were being asked 1,000 questions a day that were all super urgent? What did you think that there was in this collaboration that we were forming in the early days that made you want to join, and what do you want to see from it now?
Yeah, thank you so much, Hala, for the great question and for the invitation, and for all the rest of the panelists, Dame Sally for having me. And I certainly want to echo Karen's comment that I'm really honored to be here representing so many individuals, especially the incredible faculty, staff, students at Northeastern who have been working tirelessly as a part of the COVID-19 response. I think one of the things that's important to point out about academia is that we often don't have flexible funding, and so it requires quite a bit of maneuvering and support from the administration and university to be able to respond to something like this. So it's really been incredible to be a part of this over the past year. So, to your question about the Trinity Challenge, one of the things that is, persistently difficult in public health is ensuring that we have the right kinds of data sets in the right places for the response quickly enough. Right, as we saw back this time last year, really even earlier in January, the detection of COVID-19, of course, we didn't know it was COVID-19 at the time, the detection of COVID-19 happened pretty early. Companies like HealthMap and ProMed, they put out alerts saying that COVID-19 was there, or at least pneumonia with unknown etiology. And it was this kind of intermediate response where we didn't find out fast enough that it was transmitting via aerosol, that it was slipping through temperature screens, that we really were not having the right kinds of surveillance systems in place with respect to it coming from Europe into the United States. And so that's really an intermediate level data challenge. And in the background, the private sector companies, the public sector organizations, the academics, the public health agencies are all scrambling to get everything in place so that we can move the data into the right servers, onto the right computers, into the right people's brains, so that we can respond efficiently and effectively. And so to me, this is really just an issue of public-private data partnerships and collaboration. And these are things that many of the people on the webinar have been working on for their careers. And I've been fortunate to be a part of their efforts and learn from them. But I saw in the Trinity Challenge a real focus and desire to solve for the long term as it comes to the need to have public organizations, private organizations, as we heard, organizations that like Google and Apple will need to collaborate on technology standards if we're going to have data and applications be interoperable. All of these things that require lots of planning, coordination, and thought. And I saw that in the Trinity Challenge. And then now as we move into the public announcement around the funding, an opportunity to really catalyze the best and brightest, whether that's inside of our current circles or hopefully outside of our current circles, to bring forward the kinds of solutions that we're going to need. So I'm really excited to be a part of this. And I think this kind of model is exactly not what we need, is exactly what we have to have if we're going to prevent this kind of thing from happening again.
Super, thank you, Sam. And I'm going to take us even deeper in this question of how do we make sure we're building the right infrastructure for the long term, and in a way that is affordable, that is equitable, and that is also safe and trusted. And to help us with that, I'm going to turn to Vilas Dhar. Vilas, you are the president of the McGovern Foundation, and you have had many previous lives professionally, including being a public interest lawyer, a technologist, and now really carrying a lot of that movement towards using data and artificial intelligence for good. Could you place what we're doing in the Trinity Challenge in that landscape that you're working in?
Hala, thanks so much. Really a pleasure to be here, and thank you, Dame Sally, for hosting all of us. Hala, and the way you've laid out these questions, I see the brilliance of the architecture. So thanks for letting me respond. I'm going to draw on some of what Sam and Karen and Angela have said. So the first thing I'd like to say is I think this pandemic, even as it's become a global health crisis, has also shown us what crises of trust look like between citizens and government, in some ways between citizens and science, and between citizens and data. And as I think about what has happened as individuals, even a year now into this, are looking for sources of credible information and truth, don't quite know where to go, there's an incredible opportunity here for us to reconceptualize the role of data and science in that conversation. In a recent collaboration, we worked with Ariadne Labs and the New York Times to take the limited data sets that were available really around COVID penetration in the US and turn it into something that the average consumer of news could go to a website and say, where do I sit in the line for vaccine availability here in the US? And to get a pictorial representation. These kinds of representations change the dynamic, right? And they take data from being an abstraction to something that really influences the way people make decisions in their lives. I think to get there, there are a couple of elements that are absolutely essential. The first is we need to stop thinking about data as innovation, right? Or digital as innovation. Data and digital tech should become infrastructure available to everyone to make decisions on. And the real innovation happens not at the point of data curation or data aggregation. It happens in what we do with it. It's why I'm so excited for the announcement that Sam alluded to earlier, where we're bringing together people to actually take data and build decisionable action that actually makes people's lives better. But getting there, I think, requires us to move from thinking about architecture to building solutions. And this is where I think about platforms. And I'm so happy to be able to support the Trinity Challenge through the Patrick J. McGovern Foundation. We're also supporters of groups like MIT Solve, where what's happening is we're bringing people who understand the basic literacy and digital technology to build data-enabled decision-making, to actually build solutions, to make things that work. And we're really excited to see what the Trinity Challenge surfaces from around the world in terms of actually preparing us for the next set of pandemics. And then the last thing that I might say, just in response to your question, Hala, is we need to move from a world where we define problems in silos and find data-driven solutions to one where we let people be architects, not just of the answer, but of the problem. So particularly as we think of data-driven approaches to pandemic resilience or to disease or to antimicrobial resistance, there's obviously always going to be an element there of needing technical expertise and capacity and really the centers of deep knowledge, but also what the application of that looks like in a last mile health setting, in a rural village somewhere in sub-Saharan Africa. And making sure that we're bringing those points together in the framing of the problem that then allows us to find the data that helps us solve it. So 3 quick thoughts there, and thanks again, Hala.
Thank you very much, Vilas. I want to pick up on the point you're making about building platforms and the importance of a group like ours, I think, in sort of snowballing into something even bigger. And at the moment, I hear a lot the phrase, "Oh, it's a crowded space. There's a lot of people working on pandemic response." And I feel like saying, but we would never say that about looking for a cure for cancer. And yet the health and the economic damage that this crisis has had is on a scale that's like unimaginable. And so there's something really important in the way we go about building the Trinity Challenge that is inclusive and building these links and these networks into many other organizations and initiatives, including MIT Solve, but much wider. And on that note, I'm going to have, unfortunately, I have the tough job to keep us to time and make sure we have time for our questions and answers with the audience. But I want to take this last point about that you're making about both building very broad coalitions, but also starting by architecting the problem when we think about data and not that the solution, just the solution. And third, to Dr. Jaya Shreedhar, who's joining us from Chennai tonight. Thank you very much, Jaya, for joining. You are both a doctor and a communicator, a journalist, a public health journalist. I'd love to hear your thoughts, from the work that you've been doing for decades, going back to the HIV epidemic. Where do you think we are on the journey, and what are your reflections on some of the comments that were just made?
Thank you, Hala. And Internews is very happy to be part of this consortium, and we're looking forward to very, very exciting opportunities to partner with the absolutely wonderful team of players that we have from across the world. I just wanted to begin by saying, after listening to all the panelists, to say that data, in many ways is such a perishable good, particularly in times of emergency, in times of a public health challenge that needs quick responses. The speed, the integrity, and the efficiency with which we share data and can make the difference between life and death. And I just wanted to illustrate this with a very simple example from India's HIV response from the early 1990s. I come from the southern state of Tamil Nadu, which shares a border with the state of Andhra Pradesh. And Tamil Nadu was very quick off the block with its response to HIV and was dubbed one of the AIDS capitals of India, along with Maharashtra and Manipur. But that's because Tamil Nadu was testing large numbers of people and reporting them. We were a high detection state, if you like. And the interesting thing was roughly 40% of the cases we reported were actually from the neighboring state of Andhra Pradesh. And that important piece of data was never taken note of or utilized, when all it would have taken was for the bureaucrat who was looking at this data to call his counterpart in Andhra Pradesh and tell her that, hey, look, you have an epidemic on your hands and you don't seem to know it. So there's data here that flies in the face of denial. You need to step up your efforts to test, counsel, and prevent HIV. And it didn't look like that data sharing ever happened, because Andhra Pradesh was declared a high prevalence state a good 5 years later, and the price paid was hundreds of lives lost in the meantime. So I was just thinking, has the situation changed a lot in these times of COVID-19? We're seeing real-time data feeds from all over the world, and that gives us an illusion of being in control when we look at those dashboards. But at the same time, I had journalists in Afghanistan last week asking me how they can convince their audiences that COVID-19 is an issue, because it seems like huge numbers of people are falling mildly ill with some respiratory symptoms and recovering. So what's the big deal all about? They're not seeing the kinds of deaths that are happening in France or the UK. But maybe data on the many young people who have recovered from COVID-19 in India, who are coming back with fibrosed lungs about 4 to 5 months down the line, is important data that needs to be shared with other people in the region, young people who've gone through mild cases and recovered. But who's collecting that data? Are we depending on a diverse array of clinicians who recognize the importance, the public health responsibility of collecting and sharing that data and handing it out to other people in the region, and who's doing all that, right? That's the interesting question. So I think that there are other issues with this. When we hear the word data, we know that data collection does not automatically lead to analytics or use on the ground. There's many steps that need to be crossed. And I think the Trinity Challenge is paying attention to that. Are we going to devolve ownership for collection and use of data to those who can use it most effectively? What are the ethical aspects of that kind of data collection is something very important. And how are we going to convert the data that we collect into information that is data put into context, into the local context that makes sense to people who are going to use that data? And how do we make that data talk to them? How can we convert that data into messages and public health guidance that can actually translate into people making informed health choices? So, we can't rely on numbers alone, and there's so much that needs to happen. So I think that we need to invest resources to not only gather and report data, but also stimulate and sustain a culture that emphasizes data sharing, analysis, and use at all levels, across borders and at scale, and tap the hidden strengths of diverse players. Introduce some interdisciplinarity and transdisciplinarity into our thinking to foster innovation. And our data, information, and messaging needs to travel faster than the next virus that comes along. And that could be next year or next month, we don't know. So I think these are some of the thoughts that I wanted to share from a region like Asia, where we're facing very, very practical challenges on a day-to-day basis. So digital data collection is all fine, but it really needs to percolate down into information and messages to the people who are losing their lives on the ground every day. Thank you.
Thank you very much, Dr. Jaya. This is really interesting to hear you talking about this. And I'm seeing at least 2 questions in our Q&A questions from the audience that are linked to this. So I'm going to frame this as, we all know the potential of data and digital technology to realize great advances in health. But we've now heard from several of our speakers this note of caution around it needs to be adopted, and then it needs to be used actually used to solve, a problem that is led by the community and a real problem on the ground. We shouldn't build these solutions outside of having identified the specific problem and making sure they're going to be used. So we've got two questions that relate to that in an interesting way in the chat. One is about, and it's directed to Karen. So maybe Karen, you might want to pick up this one first. And it's about the COVID track and trace apps and the companies that have built these platforms. And one of our attendees asking, where do you think these forms of technology will be in 10, 20 years? And how do you see adoption going in a place like the UK, where we've had a track record of low adoption rate for new tech in healthcare? So that's very much a UK focused question, and I suggest Karen takes that first. But then we have also a question from Amer Sattar, who lives in West Africa at the moment, and is seeing a risk of Africa falling even further behind the rest of the world while these technology advance. And so Amer is asking the panel, how do you think, what are the major barriers to end-to-end digitization in some of these countries in West Africa where he's living at the moment? So Karen, if we start with you, and then anyone please switch in.
Great, Hala, thank you. And thank you for the question to whomever shared it with us. I won't speak for those other companies because I can't, but I will speak for what how Google is seeing this work, especially the work that we've done with Apple around the exposure notification app. The data is owned and controlled by the public health organizations and not by us, so it's theirs to use in the ways that, for example, the UK has been using it to understand the efficacy of the tool. We're going to see we've seen similar work in places like Switzerland, and there's going to be a ramp up of that kind of work, for example, in the US in partnership with the National Institute of Health. So that is one key principle, and I think it underlies the additional comments I'll make, which is for us, as a technology company, we think that there's opportunity for us to share timely, actionable data that we might have available, or that we can help public health to collect themselves, like through exposure notifications, to be useful to save lives. And that goal is borne out in the way that we've advanced other tools during the pandemic, like the community mobility reports, which is sort of a way that we have taken this concept we have on maps of the busyness factor, that you can glean how busy a restaurant or other places, and we turned that into a way that public health and governmental authorities could see how busy transportation venues were, retail areas, parks and playgrounds, to look at the impact of shelter in place or social distancing orders, and whether or not they were being adhered to, and how public health could enhance their messaging directly to the public. But also, we've now seen that data, because it's publicly available, being used in more than 1,100 publications by the research community around the world to understand not just the mobility of community, but to understand, for example, the economic implications. And so it's being woven into other data sets, and it's precisely the sort of thing that I would hope, and we would hope, we can be a useful partner by making sure that data that is anonymized, available, is available then for public good use, as well as by academia. We have another data set like this, the search symptoms trends, which is 3 years of rolling data that is got more than 400 kinds of symptoms that can be looked at, not only relevant to COVID, but of course there are things in there about mental health or substance use disorder, other, I'd say, concurrent pandemics that are tracking around the world. So data needs to be made available. It needs to, of course, be private and secure, but it needs to be useful for people who can do good with it. The public health organizations, academia, and others will partner with that, with technology or other supports where that makes sense. It's very specifically about the exposure notifications. I think we're looking, unfortunately, at a world in which we're going to really need that contact tracing tool well for many years to come, given how challenging vaccinating the entire globe will be, much less having additional vaccinations that can be boosters and or address variants. So we're going to be really needing to be vigilant with that test and trace kind of strategy. All of this to say, because I want to get this point in, because it's come up in the thread of others. I'm just going to slightly shift gears, Hala, and say One of my favorite expressions is that data moves at the speed of trust. And one of the things I think that Trinity Challenge has embedded in the way it's thinking about the work and the way that it's thinking about the importance of a global governance structure, just as much as we need to have harmonization of standards and other technology tools, it really comes down to trusting of people about where their data is originating, where it's being shared, and some transparency in that system, so they can understand that it's not only being used to be helpful to them, but to the world, and in what way. So trust underlying all of this. I hope that you guys and will be a part of that, continue to make sure we're lifting up that concept.
Thank you, Karen. It's very well said, and I sure do hope that we will. I wonder who would like to comment on this point, actually. Yeah, Vilas, go for it.
Hala, I'd love to pick up that point, Karen, from you on trust, and maybe answer the second question that was asked as well about West Africa. And I might question the premise of the inquiry. For me, I look to health innovations in Africa really as an inspiring source of figuring out what's possible. And we're seeing examples across the continent that I think are indigenously created that are advancing the frontiers of health and delivery. I think about fields as broad as kind of vaccine delivery through new technologies, restructuring kind of health record systems to allow for better participation, particularly through community health work. And even on this issue of trust, the evolution of new trust-based communication systems that have emerged in the pandemic that I think create a new socially robust way of communicating that I think we have no equivalent to here in the US or across some of the developed world. I will say though that in this question of how do we find those inspiring moments and allow them to grow to scale, there are probably a few places of direct intervention. One is in creating ways for practitioner networks to be able to identify those exemplar cases and to share them and to build platforms where they can actually grow to scale. And we found in our work in supporting some of these networks that the practitioners, again, embody this principle that we have of letting local sort of actors architect problems and solutions. And the second part is using challenges like the Trinity Challenge to build government capacity, to create the infrastructure of digital tools, which can then be used and leveraged against local data sets to come up with local solutions. I think this question of political will that Amr Sadr brought up is super important. But combined with will, we also have to address capacity and the ability to actually deliver against this, which just means we need to build some of these solutions and we need to build them in partnership.
Thank you, Vilas. And I spent the last 12 years working in government, and I was talking about this capacity question with Sam actually yesterday. So I'd love to have Sam's view around this. You know, how mature are we at the moment in the world of public health as it's done by governments in terms of the decision to either make the technology in-house or buy it from outside? How good are we? What's the practice you're seeing at the moment, Sam, and what are the barriers or what you would wish to see happen?
Well, so I had a specific infrastructure related kind of call to action, and then I'll answer the question that you're posing, Hala, which is, so I think to the great point about sort of infrastructure and investment and local solutions, one of the big challenges are cloud data centers and cloud infrastructure in particular, right? So you think about the GDPR that has laws requiring where data are stored. You have similar laws emerging in places like Kenya, but many of these countries do not have the data centers to allow for these solutions to be stored locally in, AWS or Google or Microsoft or any of the other large cloud data providers. And so I think one of the things that we're going to continue to struggle with is that while in many parts of Africa, you have incredible technology scenes, incredible resources in terms of the ability to innovate and build data solutions, that really not having access to local storage of data as a part of cloud infrastructure is going to remain a challenge and a barrier, and one that I think we really have an opportunity to address and we'll see a lot of benefits from. Now, to the question around public health, there are huge challenges, right? So we know that in the United States, for example, cross-border communication between health agencies usually happens by fax message, and that this is common, across the globe, that we have PDFs traveling, that we have hard copy paper that's communicating between individuals. And that's often why we're scrambling to respond, because we don't have the kinds of information that we need to understand what's happening locally and to communicate with our partners either regionally or internationally. And what we typically see is that governments, often even foundations and funders, don't realize there's a problem until we're in the middle of the pandemic. And then we have private sector solutions show up and basically rip and replace all the software in the middle of the pandemic, which doesn't help build trust between the private sector technology companies and the public health agencies. And so what we really need is investment in public health that is sustained and is planning for the future, especially as it pertains to technology, because as we've heard from the other panelists, that building trust is essential. And part of that trust is implementing things in such a way that you have buy-in and support and time for adoption from the public health agencies. It also creates an opportunity for public health agencies to participate in this global technology ecosystem instead of feeling the need to home grow all of the solutions when there may be things off the shelf that will both be lower cost and function at scale much more efficiently. So I think that the real call to action, as we've heard, is investment in infrastructure, especially as it relates to cloud data infrastructure in many of these areas that we've heard about that lack that capacity. And then the investment in public health, especially public health technology, and bridging this public-private gap that exists, not during the middle of the pandemic, but when we're have a little bit more of an opportunity to build those relationships and build trust.
Super, thank you very much, Sam. And Angela, I wondered if you had a perspective on this dynamic on the moment, and how much that has shifted and changed in terms of government going out to the private sector to procure some of the technology, and whether we're increasing in maturity through the experience we've had during the pandemic.
Yes, I think there definitely has been more of that. But not yet, I would say, as much at scale as it could or should have been. So there have been specific governments that really went all the way to try to remove barriers and put the contracting vehicles in place, for example, to increase the digital consultations in the middle of the pandemic almost overnight. So we had the example in the UK where we went from below 20% digital consultations to over 60% in March, April, and other countries did similar. So we see some of that as emergency mechanisms. What I think we need to see more of is more maturity in the contracting system deeper within the public sector, so that different parts of the health system can pick up different solutions and can actually mainstream the different solutions in their day-to-day work, as opposed to react as a one-off on an emergency basis. And I think that's where we need to add a few more things. So we need to begin with, I think, more digital literacy and literacy around analytics and the different solutions at the level of hospitals at the local level, or health system or primary care at the local level. We need stronger contracting, procurement mechanisms and skills at that level as well. And more clarity. I mean, again, if I take Europe as an example, more clarity around specific implications of data sharing and building the trust, as Karen said, so that people who may actually be inclined to share and want and see the value in doing so, feel that they can do so without negative implications in the future. So I think in some cases, we don't have clarity around the regulatory regime or what people are or are not allowed to do. And this is holding a lot of institutions back when it comes down to actually press and go on sharing data. So there's quite a lot of things there that, I mean, all in the mix. I think they're all coming, but we do need to speed up the pace a bit.
Thank you, Angela. Thank you all. Would any of you would like to react on this? Jaya, how does that resonate with your experience?
Yeah, I would like to react to the trust element. I really think that really sucked home, because information travels through communities fueled by trust and distrust as well. So the way we share information, who we believe, who we trust, healthcare providers are at the top of the line there, and people turn to them for good information and tend to trust them. And it's, I think, that's where the issues start, because we have a huge number of doctors in my country who are refusing to take the vaccine, for instance, just to give you a very simple example. And they're transmitting that hesitancy through their WhatsApp messaging. And that's how the trust in something that's really important is getting demolished by the people that the community looks up to. So I think that these are some of the challenges that have to be dealt with, the flow of information through the different local ecosystems, and how we're going to use data information and messaging to kind of confront those challenges. I think that's going to be really key.
Thank you very much. And it's irresistible for me to flag here the work that Internews, who you work with and you are part of, and Internews are a not-for-profit organization focused on media, doing good media work in low-income countries. And as one of our founding members, with others within the Trinity Challenge Coalition, we're setting up a pilot to really work on increasing vaccine confidence and decreasing vaccine hesitancy. And that is very much using the principle and the spirit that you just said around, tailoring the right message. And the messenger is as important as the message in many cases. And we need to become really clever and thoughtful about how we deal with some of these issues. And I hope this pilot will show a really innovative, impactful solutions for how we do that. Fantastic. Unless there is a burning additional comment on this topic from the panel, I'm not seeing any nods. I'm going to do something odd and go to Sally to answer one question that I thought was interesting in the chat, and it really goes to almost your life's work, Sally. So I want to ask you, are we linked up as the Trinity Challenge with other initiatives coming out of the EU, of the US, governments, G7, etc., etc.? What's your perspective on this?
Thank you. Well, we want to be linked up, and I think we're doing pretty well, but hey, as you hear, there are new things happening every day. And we're delighted that Sam was launching something this morning. If you look at our website, you'll see we are working with the WHO, the Global Fund, Gavi, people like that, the multilaterals. We are in discussion with a number of governments, and we are hoping to be able to show the Trinity Challenge work to the G7. We're in discussion about some of that. Of course, the whole world is looking at this, and what we're doing through the challenge is trying to find great ideas that are scalable, that will work in Africa or in big regions of the world at affordable prices, and by winning one of the challenge prizes, raise it up so people are aware of them, because there is so much activity. So part of the challenge process is to raise it up. And we're hoping this is year one of 3 years before we evaluate, do we go on? And that was another question, because we believe there is a need for this, that people should be able to be facilitated to work together and then be able to show it off so that it's picked up and people are working with them. And I must say, I am terrifically excited about how we've got NGOs working with the private sector, private to private, and academics coming in many different places. This is terrifically exciting.
Thank you very much. And you were good value here. You did answer 2 questions in my list in one go. So Mario Gonzalez had asked whether this could be more than a one-time contest. And that is definitely the plan, if you let us. There's another question that you touched on, but let me just address it briefly, from Saeed Rahman, who asked if there is a geographic focus of interest and whether ideas within the context of humanitarian aid emergencies is of interest. And the answer is absolutely yes. Our challenge is really calling on the solutions from anyone, anywhere, that will help identify, respond to, or recover from health emergencies. So we are definitely interested in that context. And I'm sure that some of the learnings around managing response and data and tools in whatever emergencies might be relevant to a health emergency. So as long as your focus is around managing health emergencies and is applicable, we really want ideas to come from anywhere. Do I have any reactions or comments from the panel? I'm looking for none. So let me just do the job now of saying that there are some questions in the Q&A from the audience, which are excellent, and we will address them, but that will start in 10 minutes. And they are specific detailed questions about the challenge, including the awards, the IP rights, etc. So fret not, we will address this, but you will have to wait for another 10 minutes. Which also allows me to pass it on to my team, who is all over the details. I think we have done a good job on the questions on this basis. And so I'm going to just turn to the panelists for just a last thought very quickly. And it can be either something that was triggered from this conversation today that you want to leave us with, or I would love to hear from you. What is the most exciting bit of work that you or your organization has done with the Trinity Challenge that you'd like to share and you haven't had a chance to do today? So over to you, and I'll take hands up or not, or waves. Jaya, please.
Yeah. Just to listening to everyone, it just occurred to me that there should be a way that we can promote a culture of respect for data at the grassroots, at the community level, where we can help communities evaluate themselves and understand data about themselves and learn to collect it and share it, and as almost like a sort of an empowerment evaluation sort of thing, where you systematically evaluate your own behavior, your own access to services, your own realization of your own rights, and learn to sort of foster a data culture from the ground up, rather than it always sort of looking to solutions from the big giants, so to speak. So I think that we need to come at this two ways, and that's what I wanted to sort of leave the panel with.
I'd love to build on that. I so agree with what you've shared, and as across different points of my career, that's been so thematic from community. And in public health, what you often learn is that the community knows very well what their challenges are, and we don't need to wait for surveillance data that's 2 years stale to give us a picture of it. And sometimes they know better because they're living it in real time, and they can inform how we want to think about collecting data with them for their use, as well as for the other purposes that we've been talking about today. So completely agree. To relate there's a question in the chat, and I just wanted to address it, Hala, which is I think one of the opportunities we have as we move through and then out of this pandemic and into the next chapter of a 21st century public health infrastructure is that we need to be much more timely, granular, actionable in the data we have. We need to have a way that we're comfortable using novel signals that are going to be more timely and granular and actionable than some of the data sources that public health typically has, that for a variety of reasons, by the time it gets to the fingertips of the epidemiologists or the policymakers or the healthcare system, isn't as relevant for the actions that we need to take. So novel signals come in many forms, and some of them were kind of called out. Some of them are about environmental signals, or they may come from social media, like that the questions that people are raising. This is an example of our search symptoms trends data that we've made available. But I do think we need to get a comfort from an epidemiologic and a data science standpoint that perfect will be the enemy of good if we're really trying to advance the public's health. We really want to make sure that we're being thoughtful, we're respecting privacy, that we're doing it with community. But I think there's a really untapped opportunity to get much more granular, actionable data that's more timely, that can do good. And so to that end, I think the white paper that some of my team has been part of crafting with the Trinity Challenge speaks to some of this, at the importance of having data that's efficient, effective, and that we can also have sustainability of that infrastructure going forward. So again, delighted to be a part of this, looking forward to really shaping a global approach, one that's with community and not just for them. Thank you.
Fantastic, thank you, Karen. And I wondered if Sam wanted to pick up quickly on this, because that's the whole, your whole life is that it is about using these different data sources.
Well, sometimes I'd like to believe I do other things as well, but no, it certainly has been a major passion of mine. And maybe the way that I'll answer this is, so I so deeply agree with the comments around community and buy-in, education, access, support, all the things that we've heard. But one of the aspects that really resonated with me about the Trinity Challenge, and that some of the other co-panelists have mentioned, is this idea of interdisciplinarity and the importance of bringing together lots of diverse sources. And so whether that's lots of diverse data sources, so that we're looking at many different data feeds as we're making our decisions, as we're integrating those into our decision processes, we can better understand bias, we can better understand the roles of different kinds of data and information in making decisions. But that also means that we're going to need a diverse and interdisciplinary set of actors who are collaborating on this. And so one of my favorite events that I participated in was between Brown and Rhode Island School of Design, where they brought together computer scientists and designers to build responses for refugee crises. And so whether that's designing more efficient ways to transport water, or designing more effective methods for tracking data in challenging environments for technology, these are individuals collaborating on that. And we've had the opportunity through this initiative that we just launched called Global.Health to work with individuals at Google and Google.org to build a new data platform. And these individuals, yes, some of them are software engineers, but many of them are designers, product experts, subject matter experts that helped us do all of the research that we needed to build this interoperable data ecosystem. And I think that's the real power and promise of things like the Trinity Challenge, is that it brings together individuals with diverse expertise and diverse interests to help us build the kinds of systems that we're going to need to have going forward. And so I'm thrilled to be a part of this, and again, truly honored to help represent Northeastern, both as a part of the Trinity Challenge and as a part of this panel. And thanks again for having me.
Thank you, Sam. Vilas, you have 1 minute, and then Sally will help us close the session.
Perfect. Thanks, Hala. Look, at the end of the day, I wear my heart on my sleeve in these conversations, and I will just tell you that I am an absolute optimist about the possibility that tech has to transform not just our health outcomes, but our power structures around information sharing and really the society we want to build. So what I am most focused on in our work with Trinity Challenge is taking the individual, the community organization, even the national health system, from being a consumer or a subscriber to data-driven decision-making, and giving them the power and ownership to make their own decisions through their own agency. I think this platform can be a really important way to give them the tools to do that. So thanks so much for letting us be a part of this.
Thank you. Sally, over to you to close the session. I just want to say that everybody has the link for the following one. All panelists and audience have the link now for the next Zoom session. So for all the detailed questions on the prize, please join that.
So thank you, panelists. Thank you, Brunswick, our founding member who set all of this up. You heard it from the panelists. I don't have to say any more. Didn't they light up our lives with what we're all trying to do? So join us in the next session. Join us in sorting the challenges and finding solutions to help communities and systems do better now and in the future. Thank you for joining us. Good afternoon. Da, 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 da.